Appreciate that. So hello, everybody, and welcome to this Tourette Association of America webinar. I'm really excited to bring you understanding when and how to ask for a school versus a neuropsychological evaluation. And this webinar is for parents and caregivers. I won't be surprised if we have a few educators joining us as well. It's a very exciting topic and fresh topic for the school year. I'm most excited to introduce you to Dr. Andrea Coppens. Dr. Coppens is a pediatric neuropsychologist at Nationwide Children's Hospital and clinical assistant professor of pediatrics at Ohio State University. She received her doctorate in clinical psychology from the University of Windsor in Ontario, Canada, and completed her postdoctoral fellowship in pediatric neuropsychology at the Hospital for Sick Children in Toronto, Ontario. Dr. Coppens serves as the director of the Neuropsychology Externship Program in the Department of Pediatric Neuropsychology at Nationwide Children's Hospital. In her clinical role, she provides neuropsychological evaluations for children with a variety of medical and neurological conditions, including those diagnosed with Tourette syndrome and tic disorders. We are funded at the Tourette Association of America by the Centers for Disease Control, the CDC, to bring this and other Tourette Association of America webinars to the Tourette community. At the end of this webinar, there will be an opportunity to do an evaluation. If you would please consider filling out that evaluation for us. We do use those evaluations to help us with future programming. I will be putting some resources in the chat. Feel free to download those resources to bring them up for yourself. And without any more delay, I will bring you Dr. Coppens. Thank you.
Thank you, Wendy. I appreciate that introduction. I'm really excited today to talk to you all about sort of this complicated question of when and how should we ask for a school assessment versus a neuropsych assessment. I know that's a question that a lot of parents ask me with a lot of my different populations, and I'm very excited to be here talking about it today. Hopefully my slides will advance. There we are. So my objectives for today are to provide you with an overview of the impact of Tourette syndrome and tic disorders on your child's thinking and learning abilities, to help you or provide you with some of the tools to understand the difference between what is a school evaluation versus a neuropsych evaluation, to give you some knowledge about when each of those evaluations are going to be most helpful for you, because you know, sometimes we want one and we're not really sure which is the right one, right, for our child. So the other piece is just going through an overview of how to actually go about requesting that evaluation. I am coming to you as a pediatric neuropsychologist, not a school psychologist or educator, but this is my perspective on you know, what I know and what I share with my families and what I encourage them to do and how to communicate back with schools. The other thing I'll say before I dive into, you know, talking about all of this stuff, a big piece that I will bring up is about education law. And so I'll talk about some of the recommendations there later. But I do want to point out, you know, I am talking about a law, which is a, you know, universal law, but there are differences in how each state might actually interpret those laws. So I'm giving you that general overview, also what I know, and I am biased by only ever practicing in the state of Ohio. So I'm a little biased to the way Ohio obviously interprets this. So if there are questions that come down the road or at the end of this presentation about what would this look like exactly in my state, and if you're worried that it might differ, then I think we would give you different recommendations about where to look and who to reach out to. So definitely important to think about your individual state's interpretation of these laws and this general information. So I want to start first just by talking about Tourette syndrome and tic disorders and helping you understand how it impacts your child's thinking and learning ability. So all in all, children with tics really don't show major impairments in thinking or learning. So we don't see a specific deficits per se, from my perspective. as a neuropsychologist, but there is an impact on their daily functioning. And so we do see specific weaknesses that are often associated with Tourette syndrome. So one of the big ones is attention. Attention issues are really common in this group. This includes things like trouble focusing. So you might think about a child who has difficulty paying attention or focusing on the teacher once the teacher starts talking. They're going to have trouble concentrating, or we'll talk about sustained attention. So this might be things like listening for the entire lesson as the teacher continues to talk to them, and they have to sustain their attention. The other piece would be trouble with dividing attention between two or more things at once, essentially. So I always imagine this is sort of the idea of, the teacher asks them to pull out their textbook and open to a page, and while they're rifling through their desk, pulling out their textbook, the teacher's now telling them the next set of instructions. So actually dividing your attention between those two things and paying attention and thinking about two things at once is really challenging, and especially for our kids with tics. Tourette syndrome is also commonly associated with this profile of executive difficulties or difficulties with executive functions. I always describe executive functions as the type of skills that the executive of a company should be really good at in order to be successful at their job. So these are things like problem solving, planning, organizing, and being flexible in the way that they think about things. So some of the most common executive functioning difficulties we see in our kids with Tourette syndrome is, for one, is the difficulty with impulsivity. So that's that idea of acting before thinking, right? And this is not totally surprising if we think about the fact that these kids have a hard time inhibiting automatic motor movements or automatic sounds, right, that go along with their tics. And so we realize that it's the same part of the brain that has a hard time inhibiting those motor movements or sounds, also has a hard time inhibiting other impulses and other behaviors. Kids often also have difficulty with flexible thinking. So sort of that idea of shifting from one way of doing things to another, or transitioning easily between tasks. So that can be a really tricky thing if the teacher is asks them to pull out that same textbook and do their math, and then says, oh, real quick, I'm going to tell you about this other test that's due next week, and now shift back to math, right? That could be a really tricky thing to go back and forth between those two things. Obviously, we know that tics are also the main component of Tourette syndrome is that we have these involuntary motor movements, right? So things like blinking or shrugging. So again, this is telling us what part of the brain is involved. And so we would expect that the part of the brain that controls motor movements is involved in lots of different ways, not just these automatic motor movements. So it makes sense then these kids will also are more likely to have difficulty coordinating movements, especially with their hands and their fingers. So often we'll see things like trouble with handwriting, manipulating scissors, learning to tie their shoes when they're young. So a lot of these motor coordination difficulties come up. When it comes to academics, that one's a little bit harder for us to tease apart. So when we look at the research, the question is always, well, is it the tics themselves that are interfering with a child's ability to learn? Or is it that kids with Tourette syndrome are just at a higher risk of learning disability? And essentially what we know from the literature is that it's a little bit of both. So we know that kids are putting a lot of effort into actually suppressing their tics in class. They're paying a lot of attention to their strategies to sort of suppress those tics and keep them in, right? And that can really impact their ability to focus on the material at hand. So they're going to have a harder time learning the information in class just in general. But we also know that there are actually much higher rates of specific learning disability or specific learning disorder in this group of children in general. And so we sort of have that double whammy there of why they're going to have a harder time in school and have potentially lower academic achievement. So, we talked a bit about the learning disability there. So I do think it's really important for us to remember and think about what are some associated, or you'll hear about it being called co-occurring conditions or disorders that are commonly seen with Tourette syndrome. So we know that about 85% of kids with Tourette syndrome are going to have another co-occurring disorder. the highest rates, the things we're most likely to see: ADHD, OCD, and specific learning disorder. And the condition that's actually most likely to impact them in school is the comorbid ADHD. So, and the reason we realize that is because ADHD itself is associated with inattention problems, executive functioning difficulties, so things like trouble with that planning and organization, impulse, inhibiting impulses, right? That's common with ADHD. And we see motor coordination difficulties in these kids with ADHD. And so then you realize, well, kids who have both of those conditions at the same time are just at even higher risk. And so all those difficulties that each condition brings can then be exacerbated, especially in the school setting. So what supports do we recommend for kids who are struggling in school? I've broken them down here into sort of thinking and learning strategies first, more behavioral strategies, and then some more formal accommodations that might be things that would need to actually go into a formal plan, like an IEP or a 504 plan. So first we think about our thinking and learning strategies, right? One of the things that can be helpful is for teachers to be readily available to provide cues to a child to help them get back on track. Help them when they're getting distracted, right? Or something else is going on. We always encourage that teachers, when they're giving an instruction, focus on what to do, not what not to do, right? Because tics can be really suggestible. So telling a kid to stop ticking, stop clearing their throat, that's not going to be helpful, right? So really focus on what is it they need to be doing in the moment. Maybe they got distracted and it's just, hey, look at this page down here, and kind of get them on track with a cue, or that redirection. Simplifying instructions can be really beneficial. So breaking down a task into small, simple steps. Instead of saying, hey, get ready for class, get your stuff ready for gym. Maybe it's breaking it down and giving a list of 3 or 4 things they need to do. And so that concept of go get ready, that's a little bit too complicated, actually simplifying those instructions can be helpful. Another thing to think about is chunking. I talk about chunking a lot so that the kids are getting what are the important pieces of information in this big long lesson or this big long set of instructions that we're giving. So I'm sure we've all made the mistake, right, of giving really long-winded instructions to our kids. And so you might say, hey, don't forget to put your boots on because it's wet and slushy outside and you're going to need your coat and your hat because of the wind. And, I hope you brought your mittens today, right? You could have this whole long set of instructions. What did that child hear, right? So instead, we want to think about chunk it. What's the information they need? Hey, change your boots. Don't forget coat, hat, mittens. I just chunked all that information and now they've got 4 things that they have to remember. So those are really helpful strategies for teachers to think of too. If they're only paying attention to a little bit of what we're saying, let's really focus in on it. Lots of reminders. So, as much as it might be hard for teachers or parents to feel like we're saying the same thing over and over, reminders about what's due this week. What should a child be studying for? What do they need to bring home at the end of the day? All of these things can be really beneficial for them just to keep them on track with some of those executive difficulties that we talked about. Kids with attention issues also really benefit from visual schedules and lists of what they're expected to do so they can stay on track. So I usually recommend that teachers maybe write a little list of what they're supposed to do and they keep it at the top of their desk. Maybe they've written it on the board so that all the students can use it. Maybe your child would benefit from having a little agenda or calendar that they keep with them just to help them know what's my schedule, what's my routine, right? And help them prepare for any transitions that are coming up. So those are a lot of those cognitive strategies that really tap into that attention and those executive difficulties. Next, I like to think about more behavior strategies. So breaks are a big one. I always recommend that breaks are scheduled into the day. We usually recommend about a 10-minute break for every hour of focused work. Or for younger kids, I usually say 5 minutes for that half hour of focused work. Also giving breaks whenever they need them, right? Just to make sure that when they are focused and doing their activities, they are paying attention, and then they just get a break to kind of let that extra energy go. Or maybe that's a chance for them to let out their tics. or practice the strategies that they're working on to help reduce those tics. So often what I think about too is kind of finding an alternative activity so they can really engage on something for a little bit, take a break and engage on something else, and come back. And that can be actually more helpful than exhausting them doing one thing for a long time. Kids can set up a signal for the teacher. So maybe let them know when they need a break if that's really something that might be helpful for your child. We definitely don't recommend, though, that teachers send kids out of class whenever they have a tic, because that can be negatively reinforcing. It can lead to actually an increase in those tics, right, in more stressful situations, or can be used as kind of an escape mechanism or escape measure, I guess, for a stressful situation. So just thinking about when they're really overwhelmed and need a break, maybe just having a little subtle signal between the child and the teacher can help. For these kids, obviously, there can be this overflow of motor movements, right? And so sometimes they'll benefit from the opportunity to stand up, walk around, maybe sit on a wiggle seat if it's not super distracting to the other kids, or doodle while they're listening to the lesson, right? Whatever kind of works that the teachers can work on them with to help get out some of that extra motor activity, but still keep their brains engaged. Obviously, kids with attention and executive difficulties thrive on structure and routine, just like I mentioned before, with the visual schedules and lists. As much routine as possible will be really helpful for them. And then on the last column here, I've listed some of those more formal accommodations. So these are things, again, that your teacher might allow the child to have. Usually we see these written into a formal plan. So things like extended time, I often recommend that if your child is getting distracted and having a hard time getting through their material without needing to take extra breaks for tics or for that distractibility, extending the time they have to actually do it can be helpful. So usually we'll recommend they get twice as long as the other kids to finish their work. Or maybe we eliminate the deadline and we just say, by the end of the term, by the end of the semester, they're getting that work done. On the flip side, though, I also often think about reducing the workload. So if they get more time to get this work done than the other kids, but they still have the same amount of work, it will start to pile and pile and pile up, right? And that becomes really challenging. So sometimes I'll recommend maybe if teachers can think, can they do half the amount of work and still show that they know how to do this? It's not overburdening their attention span. Maybe they do every other math problem, or they can do one side of the page and not the back, right? Some of those ideas can be helpful for these kids. Definitely testing in a quiet environment is very beneficial. Number one, just avoiding distractions in general for a child who has a hard time focusing their attention is helpful. It also minimizes the chance that maybe peers are going to be disrupted by tics during tests. We know that tics increase as children feel more stress, right? So obviously a testing situation can be a high stress situation. And so it's less distracting to the peers, but also reduces any stress your child might have about what if I have a tic and what if I disrupt everyone in class, right? So it can just be an easy way to get them in a good, nice, quiet place with not a lot of distractions. Because of those organization issues and those attention difficulties, sometimes kids are really bad at bringing their work home, their materials, their notes, things they need at the end of the day. So I may be dating myself. I still recommend having a second set of books, right? A set of books at home, a set of books at school, and then they don't have to remember what to bring everywhere. I recognize, though, that kids are usually using Chromebooks and things like that now, so it might be a different setup. But just thinking about, is there anything that they're carrying back and forth that could be helpful to reduce that expectation for them? Having access to notes. So usually I'll recommend things like maybe could they use a scribe in certain situations where someone's writing notes for them, or maybe they just get guided notes from the teacher. That minimizes note-taking issues that can come from having really poor divided attention. Also helps with some of that motor coordination difficulty, right? If they're taking a lot longer to copy the notes and keep up with the other kids, that can be helpful. So they can just focus on learning the material. And then obviously preferential seating. So thinking about where are they going to be best supported by the teacher? Where will they have the fewest distractions? Just thinking about that setup. So in general, when I think about all of these different types of supports, I think about the goal is to anticipate and avoid. So anticipate the environment or situation where they are going to struggle most and try to avoid before things kind of fall apart and it gets challenging. So change the environment to reduce those unwanted outcomes. So I've outlined here the different types of supports that schools might offer, sort of based on, I guess, level of formality. So schools maybe will just need to say, okay, here's some informal supports that this child with Tourette syndrome is able to get. This includes these things from the last slide where I talked about learning strategies, behavior strategies. Those are the main things that we might see go into kind of an informal plan like this. Maybe they need a little bit of extra tutoring if they're having specific difficulties in school. Sometimes teachers don't know as much about tics, or they haven't encountered a child who has Tourette syndrome, or how that could impact them at school. So often we'll recommend that we send a letter to the teachers that can outline what tics are and what they're not, how those tics can impact your child's learning, and any specific recommendations that you have or that the medical team has that are going to be most beneficial for your child. And so you can actually, you can write that letter yourself, absolutely, and provide your school with information about Tourette syndrome in general, but you can also ask your child's medical provider. And sometimes our neurologists at our hospital will write a letter like that, or psychologists who are working with the child, just to outline that information for schools. So sort of the next level up is Section 504 plan. So this is a legal document. It's a formal document that lists accommodations or supports that a child can receive so that they can access the expected curriculum. So I think the keywords when we're thinking about a 504 plan are to remember accommodations and accessing the curriculum. So we're saying that as long as they have the right strategies in place, those right accommodations, like maybe that extra time or that preferential seating, they'll be able to do the regular second grade curriculum that everybody else is doing. And so these are just formal supports that are put in place. There's no modification to the work that they're doing. There's no specific goals that are outlined. It's just a list of here are the strategies we're going to offer them. Sometimes this could include like some medical documentation. So maybe a plan for they need to visit the nurse to receive certain medications, or, if they had other medical conditions like epilepsy and they have a seizure action plan, that could be written into a 504 plan. So in a lot of ways, the 504 actually covers a lot of the needs of these kids. For children to be considered eligible for an IEP or an individualized education program, the idea there is that the child is not able to access the curriculum as it is. And so they're considered to have a disability based on this legal criteria we have for what is a disability that qualifies you under special education law. So in this situation, our keyword is modifications. So in some way we need to change the curriculum or provide us a targeted individualized intervention in order to meet the goals. So that's a little bit where it differs, right? Accommodations versus modification, and the idea of whether or not they're able to access the curriculum that's the same as their peers. The IEP can definitely include targeted academic intervention. So that could be something like a reading intervention that might also include occupational therapy, physical therapy, or speech language therapies if they need those. A behavior plan can sometimes be helpful. So sometimes what will happen is they'll also, when the schools are doing an evaluation, they might also do a functional behavioral assessment where they try to figure out sort of, again, talking about those kind of environments, anticipating the situations where things might go wrong, right? That's sort of what the FBA can do. So this document, the IEP, is also, the rules there are that it includes measurable goals. So a goal of by the end of second grade, this child will be able to do this, or whatever their specific goals are that they're expecting for the child. IEPs are also updated yearly, and there needs to include a plan for how they are going to be measured over time. So really, it has a lot of detail in it, and it's really about setting goals, deciding how we're going to measure those goals, and updating the goals regularly. So if kids with Tourette syndrome are eligible for an IEP, often we would recommend that it's based on the category of other health impairment. So when we think about IEPs, there's different disability categories that they fall under. Other health impairment is for any children who have a medical condition that is somehow interfering with their academic success. And so their neurological disorder could be one of those. Sometimes our kids will qualify under a specific learning disability. That's another eligibility category as well. But I do think it's important to realize that a lot of kids with Tourette syndrome are actually really successful with those lower levels of support, so the informal supports or the Section 504 plan. And so I'm hoping that this will just kind of highlight when each of those might be more beneficial. So you'll hear a lot about this concept of response to intervention if you've kind of looked into whether or not your child qualifies for an IEP. If your child is struggling in an area, the school's job, they're required to escalate the supports to see if that intervention resolves the concern. So schools will usually use this multi-tiered system of supports. I feel like I need to have a slide with just all my little acronyms on there, but the MTSS, multi-tiered system of supports, before they can actually start special education. So this is a way to help the kids who are struggling by escalating the support over time. If they don't meet a benchmark, we'll escalate it again. So the first tier really is just making sure all students in the school are getting high quality instruction in the general education classroom. So this is kind of your core curriculum. Students who struggle, though, are then moved up the tier to receive a little more in-depth support. And school has to really track them as they're moving through these tiers. So tier 2 involves more intensive student-specific intervention. That might be something like small group instruction, maybe a couple days a week. So if your child's having trouble learning to read, they might be pulled out for weekly reading, a reading group with the other kids and see if they catch up. And if they do, then that's great. The intervention worked, right? If they don't catch up, they might then be moved to a tier 3, which is that highest level of intensity of intervention. Often this will be more individualized, one-on-one supports, or maybe like a daily small group intervention or something of that higher level. If your child does not respond to intervention, so that's where that RTI comes in. If they don't respond to intervention, meaning they're still behind their peers, even with these 3 levels of support, then the school can go on and do an evaluation. So often we think, oh no, our kid's starting to struggle, we need an IEP today. But actually we have to recognize that the school will go through all of these steps and monitor your child over time before they actually get to that evaluation step. And that's important too when you think about a diagnosis. So as a psychologist, I can't diagnose a learning disability until I'm able to say that this child has had all the intervention and they're still struggling to learn to read or struggling with math. So that's a really important piece of it too. We don't want to say they have a learning disability or that they need an IEP when maybe they just missed out. So this slide provides an overview of what is a neuropsychological assessment and what is a school evaluation to try to help you understand which one your child might need. So you might already know, okay, my child is struggling. They've had tier 3, highest level of intervention. They've failed to respond to intervention. You know you want them to have some formal accommodations, we talked about before. Maybe they need an IEP. So what type of evaluation do they need first? And I might start to sound like a broken record because I'll talk about this a lot, but they are going to need a school evaluation no matter what, if we're going forward with, if you're seeking an IEP, but we need to decide what do they need first. So a neuropsych evaluation is conducted by a clinical psychologist who has specialized training in neuropsychology. The goal of those evaluations is to think about how their medical and neurological disorder is somehow impacting their brain. The school evaluation is conducted by a school psychologist and other school personnel, and their goal is to figure out if a child has a disability under special education law. There is definitely a lot of overlap there. So both of the evaluations will do IQ testing, We'll look at their academic testing. If there are concerns, we might look at mood and behaviors and adaptive skills and how that might be impacting them at school. For neuropsych evals, our goal is to think about that brain behavior relationship. So what is going on in the brain that's maybe leading to some of these cognitive difficulties, or neurocognitive is listed here, or thinking difficulties. So does this explain why they're having memory difficulties or slow processing speed or executive dysfunction? And then we might think about then, how is that impacting them in school and at home and in other parts of their life? The school is going to focus mostly on their academic achievement. So how are they doing in school? And do school-based, either curriculum-based assessments or other school-specific assessments. They might also bring in their occupational, physical, or speech language therapist to participate in that evaluation. They're also going to do some classroom observations in general. The purpose at the end of the day, again, for a neuropsychologist, is to think about that brain and behavior, to figure out the cause of it potentially, to diagnose and provide treatment recommendations, and to support education planning. For the school psychologist, they're not able to diagnose or give specific treatment recommendations. So that's one of the big differences. And that's what we'll talk about in the next slides. But if you're wondering about a diagnosis of one of these comorbid or co-occurring conditions, that's where a psychologist comes into play, because they can make that diagnosis. Both assessments will lead to some educational strategies and supports, but it's important to know too, school doesn't have to use a neuropsych evaluation. Often they'll do their own testing, right? They may not actually use a neuropsych evaluation if you have it. And they don't actually have to use all of the recommendations that we provide either. So it can be a really helpful piece of information that you can use and a piece of the puzzle that you can offer, but schools will do their own full evaluation. All right. Just thinking about, again, I'm flipping back and forth a bit, but when should we request a neuropsych evaluation? If you suspect that your child has a specific neurocognitive concern, right? If they have attention difficulty, executive functioning problems, motor deficits that are impacting their day-to-day function, and you want to have those skills assessed, or if there's something else going on, you're wondering, is there a memory concern? Why is it they're not able to remember what I'm telling them? The neuropsychologist can do that evaluation and try to tease those things apart. Definitely if you suspect a co-occurring diagnosis. So a psychologist can provide a diagnosis of ADHD or a specific learning disability, and that can be really helpful to then go back to school and say, hey, we actually have multiple diagnoses going on, multiple different factors. Here's why we want them considered for an IEP. And obviously, if you're looking for really specific strategies to help with learning or behavior concerns at home, at school, right? Neuropsych evaluation can be beneficial there. So how do you actually go about requesting it? You can ask your child's medical provider to place a referral to a neuropsychologist. So often here we have our neurologists will put in a referral to neuropsychology at the hospital for an assessment. You can also reach out to a private neuropsychologist and get an evaluation that way. What's going to happen next? Obviously, there's a lot of steps that go in between where you're actually going to do the evaluation, and your neuropsychologist will provide you with a really comprehensive report that lists your child's strengths and weaknesses, talks about those brain behavior relationships, and gives lots of strategies. So we always recommend that you share a copy of that evaluation report with your child's school and request that those recommended supports be considered into their academic plan. But again, know that the school is not legally required to use that evaluation as part of their own evaluation or to incorporate those recommendations into their academic programming. So often, if you do have the neuropsych evaluation first, the next step is going to be then requesting the school evaluation. So when do we request a school evaluation? Obviously, again, if there are specific academic concerns, if your child is not passing tests, they're struggling to learn to read, If you realize they need modification to their curriculum because they're not responding to the intervention that they've received, so essentially you're saying they need an IEP, that's the time that we need to request an evaluation. I do want to point out that private schools are not bound by the same laws as public schools. So sometimes what we'll see is that private schools will develop a service plan, which is a formal document that they provide. They don't have the same legal requirements as a public school. And so some of these processes might look a little bit differently, or the types of supports they can offer might actually look a little different. So how do you go about requesting a school evaluation? I actually think that the Tourette Association has a sample letter online, so that might be a helpful thing to look at later too. But you're going to write a letter to your school special education director and principal. And always keep a copy of this for your records, because this is a legal document that you are creating. So this letter has to be in writing. It can't just be a conversation that you've had with your child's school. What are you going to say in the letter? First, I want you to say, or you need to say, that you believe that your child has a disability based on their history of Tourette syndrome. You also need to talk about the fact that you believe that their disability is interfering with their academic progress, and include a couple examples as you do that about your specific concerns. Where do you see that your child is actually struggling, and that their Tourette syndrome and or ADHD is interfering with their academic success? You also want to say that you're requesting that your child have an evaluation to determine if they have a disability. So you may believe that they have this disability, but school's job is to determine whether or not they meet that legal criteria. And so you're just requesting they evaluate to decide whether or not they have a disability. And make sure you sign and date this letter, because again, this is our legal document, and you want, we'll talk later a little bit about the timeline that things have to happen, but you want to be able to show this is the date when I provided this with school, and that will help you get that ball rolling. So what happens next? The school is going to reply to your letter, and they're going to give you one of two options. So one, they might say they agree that your child might have a disability, and therefore they're going to complete a multi-factored evaluation. So it's another one, an MFE. It's another one to remember. That is, when I've been talking about school evaluation this whole time, that's that multi-factored evaluation. You're going to have multiple team members, so school psychologists, classroom teacher, speech, OT, PT, different therapists are going to get in there and do that evaluation, and they're going to write up an evaluation team report, or ETR. And that is a document that says whether or not your child has a disability. So they may say, yep, we're going to go forward, we're going to do that multi-factored evaluation and get you that ETR. Or they might say they don't think that your child has a disability and they will not be evaluating them. If your school doesn't evaluate, they will give you a copy of your legal rights as a parent or guardian. So you have the right to contest that decision that they've made. And often if it gets to that point, we recommend that parents actually seek an advocate to help support them through that process. So if they agree to evaluate your child, they go ahead and they do that multi-factored evaluation. They provide you with the ETR that outlines your child's needs and their specific disability that they've identified. Then they're going to they're going to do the evaluation, and they're going to give you the ETR, and that will either say, yes, your child has a disability, and therefore the school district or the IEP team is going to start writing that IEP. Or they might say, we did the multi-factored evaluation. Unfortunately, your child does not have a disability, so they're not eligible for an IEP, which is definitely disappointing if you feel that they need these supports. But I will say sometimes schools will say, but they don't meet criteria for an IEP based on education law, but maybe they're eligible for a Section 504 plan instead. And so I think if you want your child to have any sort of support, it's worth just kind of going through this process and getting to that point, because if they're ultimately going to get some supports, that can be helpful. But it's definitely, individualized based on different schools. So I know some schools will put informal supports in place or create 504 plans pretty easily without going through a very formal process. That definitely depends on your school. And again, depends on if it's a public school versus a private school, how that's going to, how the school will deal with that. So finally, I just wanted to show kind of a general timeline of the process. So once you request that multi-factored evaluation from your school and they agree, okay, we're going to go forward and we will evaluate your child. Within 30 days, your school will develop a plan for how they're going to do that evaluation and have you sign that consent form. Within 60 days, they will complete that evaluation. So they have 60 days to actually do the testing with your child and meet as a team and decide yes or no whether or not they meet eligibility for a disability and therefore eligibility for an IEP. If they decide that yes, your child is eligible, then within another 30 days, they will have created and implemented that IEP. And so again, it's going to take a couple of months to get the ball rolling, but it is helpful to think about within a few months that these steps should be happening. And then of course, the IEP is something that is reviewed every year. So annually from the time that the IEP is written, those goals and those plans for how we're going to evaluate and assess those goals are going to be updated. And also that multi-factored evaluation will then be repeated every 3 years. So you're going to get that updated ETR every 3 years. So that was a lot of information. And then so I'll just review for you what I think if you take nothing else away from the last half hour or so that I've been speaking. Number one, knowing that a child with Tourette syndrome is more likely to have some thinking and learning difficulties, attention and executive difficulties, higher rate of learning disorders, fine motor deficits as well. Neuropsychological evaluations are going to be most beneficial to provide your child with an additional diagnosis on top of their Tourette syndrome, or to identify specific cognitive difficulties that they're having. A school evaluation is going to be the most beneficial when your child needs school-based supports due to their Tourette syndrome or other established diagnoses, right? We already know that they have ADHD or a learning disability. Then we're going to need a school evaluation in order to get the right interventions in place. And if you feel like your child would benefit from a formal academic plan, whether or not they have had that neuropsych evaluation, you need to then request in writing that your child's school consider them for an IEP or Section 504 plan in order to get that process started. So hopefully these 4 points were made very clear and are going to be easy to remember. And I'm going to just flip to my question slide and I will open it up to questions.
Thank you so much, Andrea. What a great source of information you are for us here in the Tourette community. We really appreciate this presentation. There are some questions. I am going to ask attendees while we are taking questions. Andrea has a slide up with a QR code. If you wouldn't mind using the QR code to complete the survey while we do questions, we would really greatly appreciate it. We will also send the link to the survey and a follow-up email to attendees. So Dr. Coppens, the first question is, the 10-minute break, is that one break per class? My son has breaks on his IEP, but he never takes them. I'm wondering if I am to add onto his IEP to take 5 to 10 minutes in his designated area per class would help ease his anxiety throughout the day, or would it heighten it?
Yeah, that's a good question. I wondered too exactly how it's written. I've learned over time that sometimes IEPs will say the child has the opportunity to take a break if they need it. And so sometimes that's the issue, right? If it's left up to your child and they're going to get up and disrupt the class and walk around, they're probably not going to choose to take that break. And so usually I try to recommend maybe just changing the wording a little bit, that they are provided the break, or they are it's structured into their day that they have the break. I don't necessarily know if I would advocate for it has to be, every class, but I think having those structured times in the day where the teacher just gives them that opportunity. And sometimes it can be helpful to say, I need help. Actually, can you come grab these papers from the front of the room, take them to drop them off at somebody else's classroom or the principal's office, just to give them an activity to do and have that break. But I think what I have seen is that giving the child the opportunity, if it's stand out amongst their peers or not, they're not going to take that opportunity, even if they really need it.
Thank you, Dr. Coppens. The next question, and I want everyone to know, I think I said it, I typed it in the chat, but if everyone, anyone who has any questions, please feel free to type them in the Q&A, the question and answer panel that you have on your Zoom screen. The next question is, do you qualify for an IEP if your child is receiving occupational therapy outside of the school? Or is it required if he or she is doing therapy outside of the school?
So I don't believe that having services outside of school would disqualify you for having services within an IEP. I do think a little bit outside of my wheelhouse necessarily in terms of the types of therapies, but often children don't necessarily qualify for OT services in school specifically. And so sometimes that wouldn't be part of their IEP, even if they have that outside of school. Often schools will think about the functional impact of it. So if they can still hold a pencil or type and keep up with everybody else, then they may not actually qualify for OT. I'm just thinking back to the question because I want to make sure that I'm answering the question. I think that it sounds like what you're saying is, would it disqualify you? And I would say no. But you don't need to be doing therapy outside of school in order to receive it in school. Hopefully that made sense.
Yeah, it definitely did. It sounds like you answered the question. So the next question, do you need a school evaluation for a 504 plan?
Mm-hmm. Yeah, that's where, again, I wish I had a school expert here. I really think that it depends on the school. I believe they're going to do some sort of evaluation either way to get a 504 plan. The times I've seen it is sort of, it's not really called a 504. It's one of those like service plans or maybe an informal plan that's been created. I believe that you need a school evaluation, but maybe we'll double check our facts after this.
Thank you. The next question is, my son is a teenager. What do you recommend regarding his impulse when he gets mad, he throws stuff?
Yeah, that's a tough one. I think there could be so many different factors involved here. I mean, obviously, without sitting down and doing a full interview with you and finding out all the details, it's hard to give specific recommendations. I think for me, it's always going back to figuring out sort of the root cause of it, or I mean, obviously we're talking about impulsivity, but sort of that like anticipating in what situations do things go wrong. So usually I talk about that same thing I said here in this group of anticipating when things are going to go wrong and trying to change the environment before it happens. So for me, I would be thinking about what are the situations when he's getting most upset, and is there a way that we can totally preempt that from happening? Because knowing he has impulse difficulties, when he gets mad, that's what's going to happen, right? He's going to have a really hard time controlling his impulses. So it's thinking back to how can we change that environment? Same thing for teachers, right? What is a situation where a child is going to get really frustrated and mad and shut down? And can we actually prevent that from happening before we even get there? That's usually my recommendation there.
Thanks, Dr. Coppens. Are there any other questions? You can type them into the question and answer. We do have a few more minutes. And if you have not done the evaluation using your phone and the QR code, we would greatly appreciate it. If you're not able to do that right now, we will send the survey link in a follow-up email to all the attendees and registrants. If there aren't any more questions, and I'll wait a few more minutes, I was just going to jump in and about that school evaluation for the 504 plan. Usually you do not need the formal evaluation that Dr. Coppens is talking about. The school certainly would. That's my understanding. Dr. Coppens in the school would usually, may have some evaluations and observations that they use to help with those accommodations in the 504 plan. Oftentimes those evaluations are done because a family or a school may be thinking that the student may need the IEP, and then they have the evaluation for the 504. I love school evaluations, so I really appreciate this webinar. And neuropsych evaluations. Absolutely. I just think they're so informative for our students with Tourette and co-occurring conditions. So it looks like I did wait a few more minutes for any more questions.
More questions in the chat. I'm sorry, Wendy. 2 more in the chat.
Oh, thank you. Okay. Oh, here's one. Okay, I got them. We haven't needed a school evaluation for a 504 in either school district. So someone's confirming that.
That makes sense.
And then here's one. My 7-year-old is scheduled for a private neuropsych evaluation because of difficulties starting writing. He excels academically, but for some reason had a very difficult time started writing throughout kindergarten and 1st grade. Much of his writing journal was blank, even though he reads above grade level and has good handwriting. Does a neuropsych evaluation seem appropriate in this instance?
Yeah, that's a tricky case. I think it does sound appropriate for sure. I think that is a situation where I would see a child where we can say, we've ruled out that he is not able to read. We know he's reading above grade level. He's able to actually use a pencil and print. So, we know he can do that piece. And so where is the disconnect, right? And so as I'm thinking through as a neuropsychologist, I'm wondering, is it an attention issue? He's getting so distracted. Is it an organization issue? Kind of putting down his thoughts on paper, or is there something else going on? We always have to think about anxiety or mood or things like that. So I think that is a place that a neuropsychologist can definitely take a closer look.
Thank you. Here's one more. I'm sorry, I'm just trying to see. There's some typos in it, so I want to make sure I read it right. If an individual in a college has a test, sorry, I can't decipher if whoever wrote the question about the college test, if they could retype it. I'm just having a hard time deciphering because of the typos in it. Oh, I see. They want to know if they have a test with a college versus the neurology clinic, referring to a neuropsychological physical evaluation. Yeah, I'm not sure what the question is. So if somebody could, whoever wrote the question about the college test versus the neurology clinic, if you could retype that in the question and answer section, I would really appreciate it. I'm having a hard time reading that one. And I think, college, not physical. Let's see, if an individual in a college has a test with a college versus a neurology clinic, referring to a neurological Let's see, I'm still not sure of the question. I know someone's trying to type college and not physical clinic fall under the neurological tests we are dealing with in this program herein. I just think that the question is hard about a test in college. I'm not sure I can decipher it. I'm sorry.
I did see another question pop up just ahead of it.
Okay.
Sorry, they're asking about private neuropsychological evaluations are expensive, absolutely. Yes. And advice on how to locate one that might be budget friendly. I mean, yes, that is a hard one. I think you, if your child is diagnosed with Tourette syndrome, that is a neurological condition. And so that would qualify them to be seen by a hospital-based neuropsychologist. And again, most hospitals, as far as I know, would allow for that. That those can be very long wait lists. That can be a tricky one to get into, but insurance would often be involved there. One of the other things that I would think about that I definitely recommend to my families is, depending on the specific questions you have, thinking about other types of providers who could help. So if the question is, does my child have ADHD on top of Tourette syndrome? That is something that a physician, their pediatrician, can diagnose. And so that can actually save you the trouble of going through a full day neuropsych evaluation. Is actually going to your pediatrician and they fill out questionnaires and ask you questions and can get a diagnosis that way that can start getting the ball rolling, or looking into other psychologists, again, can make diagnoses. It doesn't necessarily have to be a neuropsych evaluation. That being said, if it is really specifically that you're looking at evaluating their cognitive skills, then unfortunately that's a tough one, because those private evaluations are definitely expensive.
Thank you, Dr. Coppens. That seems to be the last of the questions, and that works out perfectly because we are at the end of time. So we would very much like to thank you for doing this webinar for the Tourette Association and the Tourette community. We are excited that we will send a link to attendees, and our webinar will live on our Tourette Association of America YouTube, which if you do access, we have some really great webinars and resources there. Please also access our website at tourette.org, www.tourette.org, for more resources that you need. And you can reach out anytime to support@tourette.org. That's support@tourette.org with any questions regarding education, physicians, anything else that you need. We are here to help the Tourette community. And Dr. Coppens, we just so appreciate you as part of this community and doing this webinar for us. Thank you so very much. And everybody, thank you for being on, and have a wonderful evening.
Thank you so much.